Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Hello, everyone. Welcome to another edition of the Empowering Plans Podcast. I'm your host for today, Brady Bizarro, attorney from the FIA Group and director of our Legal Compliance and Regulatory Affairs Department. And joining me today, a special guest, one of our great attorneys whose loving interest in politics matches mine, Nick Bond. Say hello, Nick.
Howdy, Brady. How you doing?
I'm doing swell. It's been a while since I've done a podcast. I feel like it's been too long. So I am stoked to get back in on this one. Great to have you along with us. I know all of our listeners out there miss my voice as well, so I'm happy about that. But what we're going to do today is, I think, a great opportunity to cover a lot of ground because we're going to do a kind of lightning round of topics. There's a lot that's happened in the world of COVID, in the world of politics, healthcare policy. And so Nick and I met before and we said, you know what we're going to do? We're going to do a lightning round. We're going to talk about 5 or 6 big topics, go back and forth around the horn, hopefully keeps things interesting and fresh for all the listeners out there. And as always, if you have more questions or you want more detail on some of these topics, I am positive that we've addressed them in other webinars, in our blog, other published works that we've done. And of course, you can always submit questions to ptcreferral@fiagroup.com, and we'll be happy to consult with our legal team internally and get you an answer on any questions you may have. But of course, even though we thought we would start with something different, we've got to talk about COVID. Because as everyone knows at home, we're not out of the woods yet. How did the CDC put it? The war has changed. We've got the Delta variant kind of spiraling out of control. We're recording this first few days of August, and here in Massachusetts, there's been a lot of developments. We've sort of been like a petri dish where we had breakout cases on vaccinated people down on the Cape, and the CDC has looked at that as a case study in what these cases look like for vaccinated people. I mean, basically, Nick, what we've got is, a case where people are getting COVID who have been vaccinated. That was always known to happen, right? They've got very, very mild conditions. Almost nobody who's been hospitalized or died has been someone who's been vaccinated. But there's a lot of confusion out there now because you've got a lot of new guidance coming out from the CDC, from the states. You've got employers that are panicking and pushing back their return to work days. And, even in FIA, we've had a couple of incidents where few scares here and there. People are vaccinated for the most part. People are wearing masks when they're not. We're being as safe as we can, but it's pretty scary out there. I don't know what you're seeing, Nick.
Yeah, I'm I think in the same headspace you are with the pandemic and with the Delta variant. We felt so confident at the beginning of the summer with people getting vaccinated and trying to get everybody. What was the Biden administration's goal? Was 70% vaccinated by July 4th, I think. And I think we literally this Monday just finally hit that goal. So vaccination rates weren't quite where we'd hoped they'd be, but I think that I at least had been really enjoying not having to wear a mask in public and being able to go to restaurants and the store without worrying. And now some of the news about the variants kind of makes you second guess that. We thought we were kind of seeing a light at the end of the tunnel, and now it feels like the tunnel just got twice as long again. But that's something we've been seeing a lot of. Apparently, the CDC did, I think, Provincetown, where there was a big outbreak, and the CDC kind of analyzed some of the data coming back from there. And they found that even people who are vaccinated can potentially transmit the virus. I think the important thing to note is that the vaccinated people themselves, like you said, are having very mild symptoms. They aren't having to be hospitalized. Their risk of serious complications is significantly lower than anyone who's unvaccinated, but it seems that they're still capable of transmitting the virus. So even people who are vaccinated in some parts of the country, in some parts here in Massachusetts, are being asked to start masking up again. And it feels kind of a 1 step forward, 2 steps back kind of situation, I guess.
Yeah, I'll just be honest and say it's frustrating and it's confusing. We've gotten questions in our consulting inbox from concerned clients who are asking, now that the CDC has put out recommendations for masking, what should they be doing at their workplace? What concerns should they have among their employee populations? I mean, you're right. We're kind of going backwards here. A lot to do with the unvaccinated, but also just the version of this variant being so aggressive and whatnot. It's kind of become a big mess. Bottom line, that the CDC's recommendation is just that. It's a recommendation. Here in Massachusetts, also a recommendation. It's pretty rare to see mandates coming back. However, it's like New York City, I think New York State employees as well may have some kind of mandate. So what we would encourage clients to do and our partners in the industry is, of course, look at your state and local guidance. If you've got a federal workforce, there were some rules or some orders issued by President Biden the other day about federal employees. But for the most part, I think the CDC's been saying they don't expect lockdowns to come back, but listen to your public health authorities, obviously. My concern here is that what we don't want to do is discourage getting vaccinated. And one of the reasons to do that was to return to normal, right? Take off the mask and put it away. And now at least I'm worried about that maybe discouraging people. Although I'll say that, Nick, I think it's a good sign. Just yesterday, I heard the CDC was talking to the FDA and hearing that we might get full approval for at least the Pfizer vaccine in the next month or so. And that may convince many of the holdouts to get vaccinated. And I think it'll strengthen those employers and those other government entities who might think about vaccine mandates. I know a lot of people have been waiting for full approval to make decisions about that, and hopefully that moves us in the right direction.
Yeah, I know anecdotally a few of the people in my life who have been a little cold or a little tentative to get the vaccine. That's something that they've cited a lot, is that these vaccines are still so new and they haven't been given full approval by the FDA. And I think that if the FDA can show that they've pretty thoroughly reviewed the efficacy and the side effects of these vaccines, that they can grant them the full FDA approval stamp, I think that would go a long way to assuaging at least a few holdouts' fears against the vaccines. So hopefully that'll encourage more and more people. But we'll have to see, I guess.
Yeah, I want to move on to a few other topics we have in our lightning round, but I guess one last thing is someone asked the other day a question about, why aren't we seeing the vaccines being advertised on TV? They, after all, are being sold by private companies, or the government mostly bought the vaccines. But the answer is because actually under the emergency use authorization, they're not allowed to promote these vaccines. So that's why you haven't seen a flood of commercials, right, encouraging you to get the shot. But I think fair to say that once we get full approval, you'll probably start seeing a lot more of that down the line. And one of the last questions that we get oftentimes is, about testing requirements, who's paying for that. Keep in mind that the EEOC says that if you as an employer are going to continue to mandate testing, and we're seeing a lot more of that now done by cities and states, their guidance is that you should be paying for it as the employer. So if the city of New York wants to mandate that their employees either get the vaccine or get tested on a weekly basis, I think in some cases even twice a week, the EEOC has suggested that should be paid for by the employer, because these tests can be expensive and, that would be burdensome in their view on the employees. So keep in mind, if you're going to do that, you want to get that question answered squarely, and we can help you if you have particular questions about testing and continuing to pay for testing, as well as that, alleged booster shot, whenever it gets recommended, who's going to pay for that. We'll have some more information about that in the coming weeks as well. But another topic we want to move on to that's probably as confusing, but a little more optimistic, I guess you could say, is the ARPA guidance from the IRS. Sounds great, right? So we know the American Rescue Plan Act was passed a few months ago, and it did contain a number of provisions which were meant to really alleviate the burden on employees who may have had, for whatever reason, an event which triggered them to lose health coverage. So there were a number of modifications made to Cobra rules, and subsidies were provided. And it's a really big mismatch of, who's eligible for the Cobra subsidy, what triggers eligibility, how long are they eligible. So Nick, I know you've been following this closer than I have, and I guess recently the IRS put out some clarification, I guess because, not surprisingly, people were pretty confused about various scenarios involving their employees. So what do you think about what they put out? Is it going to clarify things? Is it just going to lead to more questions?
Well, as usual with the IRS, I think that they answered a few questions and they raised even more. I think part of the confusion around the ARPA subsidies, and this has kind of been one of my hobby horses for the last few months now, some of the confusion around the ARPA Cobra subsidy has just been that it was kind of implemented so quickly and sort of a ready, fire, aim approach from the IRS that people had to jump on board with covering this expanded Cobra right without really having a whole lot of guidance beforehand. And we're actually pretty significantly through the subsidy period that was created under ARPA. That period runs from April 1st through September 30th of this year. Here in the early days of August, we're kind of 2/3 of the way through that subsidy period, and we're still getting guidance coming out from the IRS. But I think a few of the big questions that this notice released, the IRS released this notice on the 26th. So it's not quite hot off the presses, but it's still kind of flown under a lot of people's radar, I think. This guidance answered a few questions like who exactly is eligible to claim the tax credit. So the way the subsidy is structured, employers or the insurance companies cover upfront the premium costs for employees' Cobra continuation coverage, and they get reimbursed on the back end through a tax credit. And one of the big questions has been for a while now, who exactly is eligible to claim that tax credit? And the way the new guidance appears to shake that out is effectively the common law employer of those employees is the entity that is specifically entitled to the tax credit. So that sort of helps set up some clear guide rails as to who should be paying the cost of those premiums to provide the subsidy to the employees, and then who exactly will be filing on the back end to request the tax credits so that they get reimbursed for covering the subsidy, which is definitely helpful. They also answered the question of whether employees who have exhausted their standard COBRA, this traditional 18 months of COBRA, if any of them were on an extension of COBRA due to a secondary disability, or if they'd had that maximum coverage period extended for any reason. They answered that those employees that are on an extended potential COBRA leave, they're also entitled to the subsidy within the subsidy period. So if any portion of their extended COBRA coverage falls in that window from April to the end of September, then they're also an applicable individual under ARPA to receive that subsidy. So they've clarified a few things like that. They've also pointed out that even an individual who was using COBRA continuation coverage just to cover something like their medical or vision coverage, if they weren't on COBRA continuation of full healthcare coverage, as soon as that individual becomes eligible under any other group health plan or say Medicaid, they immediately lose eligibility for the subsidy. Even if it's for something like Medicaid, that may not cover the vision and dental benefits that they were continuing through COBRA coverage. So that's sort of a very specific, nuanced situation that we got an answer to, but there's lots still to dig through in ARPA, and we're expecting more guidance to be coming out. I think we're still waiting for the IRS to provide us model notices for termination of the ARPA subsidy. So we've still got a lot to look forward to from the IRS.
Yeah, I mean, that's not surprising. I'll say I think we're failing at our goal of doing a lightning round here. I think the lightning strikes are very long. But let's fly through and get to the last two.
Very mellow lightning bolts.
Absolutely. But no, I mean, the takeaway here, and this is the next topic I want to talk about as well, is the same problem, and that is the No Surprises Act. We've had a lot of legislation and rulemaking that, in my view, has been rushed. And this is why you have so much supplemental guidance coming out in the coming months. I mean, this really been the trend for almost a decade now in Washington, where it's like nothing much seems to get done legislatively. And then the agencies are filling the gaps here by providing rulemaking. And oftentimes they go beyond the scope of what they're supposed to, and you have courts step in and strike things down. Notwithstanding that issue, the other issue is that they have to come back out later with reams of, supplemental notices and guidance because the issues weren't, in some cases, thought through enough. So the No Surprises Act is another example here where this bill came out as part of a larger consolidation bill that passed at the end of last year. The No Surprises Act itself goes into effect January 2022. And I mean, basically remember that this legislation aims to prohibit providers from balance billing in certain cases only. So out-of-network emergency services, out-of-network non-emergency items provided in in-network facilities, and then finally out-of-network or air ambulance healthcare items and services. There's a whole IDR process for arbitrating disputes that's come out, but really lately they put out some guidance to supplement the rule here to define emergency services, which is still a bit confusing and not entirely clear. They've outlined some of the exceptions and what they mean. So, there's consent exceptions. So if a provider gets their consent, they can balance bill you, things like that. But we're going to be watching a lot more as more things come out between now and the end of the year. We're getting closer, though, to the end of the year. And so we expect to see more guidance released that flushes out the actual arbitration process. Some of these definitions are still not defined. Time frame is not exactly clear how the IDR process will work alongside the appeal process under ERISA itself. But just know that we have our finger on that pulse pretty strongly. And yeah, we'll be updating you guys as we get more information from the agencies. But my takeaway is it's a bit frustrating having to sort of wait with bated breath as they slowly leak out more and more information that really should have been provided at the start. But, such is the government right now. All right, I guess we have one more topic here. Time for one more thing in our lightning round. And that is one, honestly, if we could probably do a whole podcast on this bill itself, or maybe on the second version of it, because this infrastructure bill, people paying attention to what's going on in Congress probably know that this 2,700-page bill, the text of it was released by the Senate on Sunday night. And, we want to talk about what impact will this have on healthcare. Just before we dig into this bill here from a high level, just know that there is another bill that is supposed to be passing along with this bipartisan bill is there's a two-track process going on. There's a reconciliation bill, which is a $3.5 trillion bill, which we expect will have a lot more provisions related to healthcare. That's not what this bill is. This bill is the bipartisan version. It scales back, if you can believe that, even though it's still about $1 trillion. And the truth is there's not a ton in this bill that directly impacts health plans or self-funded insurance, but there are provisions which will impact providers. And so that's why it's important to be aware of what those are and, the impact that will go there. One thing I caught my eye, Nick, pretty early on when I was reading through the summary of the bill and looking through the sections is they're basically going to allow a 2% cut to Medicare reimbursement. So that was apparently a planned cut that they had delayed because of the impact of COVID-19 on providers. But now they're going to resume that. And 2% may not seem like a lot in a vacuum, but over, millions of claims, it's a big deal for providers, right? When they're getting less reimbursement overall from the government. And therefore, for our purposes, for plans that rely on Medicare reimbursement rates, they'll be lower as well by 2%, right? In theory.
Yeah, I think that that's going to be a sore spot for a lot of providers that are dealing with plans using Medicare-based pricing or RVP. Any tiny cut into that Medicare reimbursement rate, they're going to cry foul. And you can kind of see why, because like you said, 2% just in a vacuum doesn't seem like that much. But some of these hospitals, they're getting paid on Medicare-based rates for mass numbers of the patient populations that they're treating. And that could be a significant impact. That's the sort of reimbursement cut that we're seeing factor into things like smaller local hospitals that are not able to make the kind of money that they need to stay operational. And we're seeing that sort of lead to some of these small local hospitals being bought up by larger healthcare systems. And so it leads to the vicious cycle of small hospitals kind of racking up a lot of outstanding payments and not being able to kind of meet their obligations, and seeing more and more consolidation in the hospital space. And that kind of just turns around, instead of dealing with a local hospital, you're suddenly dealing with a massive hospital system that might be a little more aggressive in pursuing some of those balance bills. And so this is the kind of thing, it looks small when you see it on paper, especially in comparison to the $1 trillion, 2,700 other things in this bill, but it could have a real impact on hospital systems and patients that have to deal with them.
Right. It's almost like the butterfly effect. It's a small effect that can have unintended consequences and causing, more consolidation, more mergers, and et cetera. But two last things I just want to get in here before we wrap up on this version of the podcast is there's something here about how the government will not raid the provider relief fund. That's good news for providers. So remember, they received a lot of money on the CARES Act to help boost their revenue, frankly, during COVID-19. And some of that money hasn't been spent yet. And usually the government's pretty good at repurposing that money in other places, but it looks like they're going to leave that money alone. So that's a win for providers there. And then finally here on refunding Medicare for any discarded drugs under the Medicare Part B program is a big area where, providers make a lot of money, and so do drug manufacturers purchasing drugs through the Medicare Part B program. It looks like in this case, the government's trying to combat some waste and trying to fix that issue there by demanding refunds. So again, not impacting us directly, but I think a lot of these things in this bill, you might find standard versions in the next version of the bill, which will be the reconciliation bill. So stay tuned for that. We expect the text of that bill to come out in the next week or so. And that's where you'll see a lot more provisions added in by the Democrats in the White House that want to address healthcare in a more robust way. So we'll be looking out for that, and we'll have a lot more to say as the text comes out on that. But for now, I think we got through about 5 or 6 topics. Not bad for our lightning round. Our first one, I think, for you and I, we'll do more in the future, and we'll be faster. I can promise that.
Yeah, we can do better.
Absolutely. But for now, I want to thank you, Nick, and our producer, Pat the Man Santos. And thanks to all of our listeners for tuning in to another edition of the Empowering Plans podcast. We'll talk to you all later.